U.S. District Court.
Yeah, so basically what's been happening in our state, we're the only state in the nation that shut down our door to Medicaid applications.
What does that mean, shut down that door? I thought Medicaid, it's a federal program and it's everywhere. So we said, no, we don't want you to come in here?
Well, we just basically closed the Department of Human Services office where people for 40 years have applied for that program. So we laid off those people. We said, go home. If you want to apply for Medicaid in our state, the only way to apply is through healthcare.gov.
So you have to go straight to the feds to do it as opposed to go through an office within our state that will help you through that process.
Right. You have to go straight to a computer.
Okay.
And the computer was not designed to assess Medicaid eligibility. The computer was set up for these new categories under the Affordable Care Act. So every other state continues to process their own Medicaid applications, except for Tennessee.
Okay.
In Tennessee, we have the only way to apply is to go to this computer system that wasn't meant to help some people. And so we went to the court and asked for help. We had 11 individuals who were in the spin cycle. They applied months and months before. They were going without needed medical care. We had newborns. We had people with chronic illnesses who were going without life-saving medical care. And the court said basically the state is responsible. They have to fix their own program. It's their program. The state said, oh, no, this is the feds' fault. And they blamed the feds. The judge rejected that and said, basically, this is your responsibility. You get billions of dollars from the federal government. Fix your own program and decide whether or not these people are eligible.
And this money, it was, and finally, for the first time, I'm seeing kind of through it, this money that's available from the federal government has not been able to get to these people who need it right now because the state's not administering it. We're the only state in the union that does that. And so they're trying to go through this computer system to do it, which is not equipped to do it. So they're not getting anything. So none of the monies that's available from the feds, millions, coming to the state. How long has this been going on now?
Well, since October 2013 is what the judge said. If you applied October 2013 all the way until now and you aren't getting a determination, you can appeal. You can appeal now. Basically, the judge says, enough already. Make a determination on these people. And the way he ordered that the state make a determination is that people who have been stuck in limbo now have an opportunity to appeal. And so
okay, but the state's going to have to start holding these hearings. The state's going to have to do that. They're going to have to get it up and running. And I'm trying to get a handle on why the state did something like this. And I see that in the argument from TennCare, their attorney, they blame the Federal Insurance Exchange. And, I think a lot of people may, who are suffering think, well, this is happening to me and the hospitals are picking up the bill and passing it on to us because of Obamacare. And it seems like that's not it. I mean, if it was, we'd be seeing this happen in other states around the country. So to blame this on Obamacare, I think, is wrong.
Right. There are two big failures. One is that we laid off all of these Department of Human Services.
As a cost savings measure, is that it?
I don't know. It couldn't be a cost savings measure for the state as a whole because that means that we're turning down this money. So we have a newborn preemie who is in the neonatal intensive care unit. If her application had been processed in the way that it is in every other state in the nation, we would get a match, 2/3 federal match for that baby. But what happens in Tennessee is the hospitals are eating all that cost. This family is going into debt for the rest of their life. It doesn't make sense. It doesn't make sense for a baby who deserves to have health care. And the problem is for that mother, she's terrified about her baby's health, and now she's terrified about basically financial ruin, and that the hospital will at some point discharge the baby before she needs it. So that's the real problem, and that's what the federal judge found. The problem is not one of the feds making. The problem is one of the states, and so fix it is what the judge ordered. And for the folks who have been in limbo, he gave them an opportunity to find an answer. And so if there are people who are going without care right now, they can appeal today.
How do they go about doing that?
So the Tennessee Health Connection is a hotline that the state has, and I have a phone number. You can.
We'll give it out several times through the program, and not people, if you're sitting there watching, get your pen and paper, and we'll give it out more than once. But it's, what is it, Tennessee Health Connection?
It's 855-259-0701.
Okay.
And find out who you're talking to. Write down the time and date of your call and hold on to that. There's been some problems with holding on to information sometimes there. So hold on to that information, and if you have problems and you need help through the appeal process, the Legal Aid Society of Middle Tennessee and the Cumberlands, as well as our office, have agreed to help people. So we have that number as well, but don't want to overwhelm people with numbers.
Yeah, it's we'll give more of those numbers. I just can't help but think, and I fully don't understand every aspect of it, and certainly we don't have Michael Kirk, the attorney for TennCare, on with us to tell his side of it. But I think if the general public, as basic and straightforward as you're laying it out here, understands it, I just can't imagine every person in Tennessee not being furious about this. Maybe I'm missing something, but I mean, 2/3 matching money from the feds that could be coming in right now to help in these cases that are getting treatment anyway, and you and I are paying for the increased premiums as hospitals try to cover these costs. It's odd that it's not a bigger story, in that it's just infuriating. And you're such a cool customer, and I know it makes you mad, but you're always calm and you lay it out there. But I can't imagine more Tennesseans aren't furious about this and wondering, what on earth is this state? You know what, by the way, it'd be one thing if we looked and half the country was doing this and there was a real issue. We're the only one. Mm-hmm. You know what? Not always true. Sometimes you swim upstream against everyone else, but you're the only one, and you got to wonder, what are we missing here? Mm-hmm. How come? Why are we the only ones doing this? Could we possibly be doing something wrong?
Yeah. Well, I mean, and we contracted, there was supposed to be a computer system up and running by now. It was supposed to be up by October 2013. It was supposed to be up by January. Before the legislature a couple weeks ago, Darren Gordon said he didn't know when the computer system would be up and running. So every other state has a computer system that takes their own unique categories of Medicaid. There's 27 Medicaid categories in our state. We don't have that. And, computer systems work sometimes they do, sometimes they don't. But I guess the bottom line is having those layoffs in the Department of Human Services offices means that all of these low-income folks, and mostly vulnerable babies, people with really terminal illnesses, are facing closed doors when they need it most, when they need help the most.
And was this something basically spearheaded by the governor, or was it lawmakers?
It was the governor and the TennCare Bureau. The lawmakers were not really involved.
Okay. So they weren't really as involved with it. But the guy, I remember when it happened with the governor, and I wondered what else along the way. And I always wondered if there were politics involved, and who knows? You say not as much so, I mean, your observation, it's just, or maybe cost savings. I'm trying to figure out the motivation behind doing it this way, to lay off all those people there. But, at the outset, it's kind of like, you see a lot of these, and there are a lot of other conservative states out there also that are just as much, perhaps, as a state against things like, Obamacare, but they're not doing this. And I just remember when it happened, I remember looking and thinking, well, this is our governor who's Republican and maybe doesn't agree with some elements of Obamacare, putting his foot down and saying, we're not going to participate. And I was like, man, that's wrong, dude. I mean, it's not the way. I mean, there's other ways not to do this besides hurting these folks. Yeah,
I mean, the fact is, this is a Medicaid program that we've run in our state for 40 years.
Program.
It's always been. This is not newly eligible Obamacare. These are the most vulnerable Tennesseans. And so, an example, last week, we've gotten about 300 calls in the last 8 weeks. 300 calls. One of them last week was a veteran who has a 12-year-old daughter with asthma, and she's basically going without care. She's going without the medicine to keep her healthy 12-year-old, except for the asthma. Now, he's a veteran, and I mean, it makes no sense. It makes no sense from any perspective.
Yeah. Well, listen, as we're going to go to the break, and we're going to get some phone calls, 737-7587. Let me give you the phone number. We'll give it out each time at the end. As she said, the Tennessee Health Care Connection, or Health Connection, Tennessee Health Connection, 855-259-0701, where you can start calling now to start, thanks to this judge's decision from earlier this month, seeking out and trying to get those benefits you've been waiting for. So we'll take a break. Be back with your phone calls. If you're on hold, Stephanie, Joe, and others, we've got lines open, 737-7587. Back with more right after this.